call it. Hopefully we will get back to a regular environment, but we will probably need to do this again at least next month also. And patience and consideration as we move forward, and what we find doesn't work, we will try to get fixed by the next meeting. So I would also like to state that committee members that we can see, and I don't know for those that we can't, if you have your little reaction deal down there that you can raise your hand, but we will try to, between Allison and myself, try to keep in line who's first, second, third, etc. as we bring things. And if you're new to Zoom, if we try to talk while someone else is talking, it pretty much blanks everybody out. So that's just a little snippet there. So I would like to call the meeting to order, and Allison, will you please take roll call?
I will. Great. So we have Chairperson Donna Muschetti.
Present.
Chairman Mark Myrtle.
Here. Here.
Chairperson Mika Ferretta.
Here.
Chairperson Ace Barish.
Here.
Or not chairperson, I'm sorry. Committee member Jed Diamond.
I'm here.
Committee member Janine Miller.
Here.
Committee member Shannon Riley.
I'm here.
Committee member Tom Ullman.
Virtually here.
And committee member Lloyd Weir.
I'm here.
And committee member Carmel Angelo.
Here.
And no
And
wrong.
committee member Tom Ullman.
About Mika.
Oh,
I'm here.
Mika.
excuse me, Commissioner Allman, we can barely hear you, or at least I can barely hear you.
What about now?
Better.
All right, I'll talk louder.
Okay. Thank you, Allison. I would also like to let the committee and the public know that Allison has been transferred to Doris Street and is now under the direct supervision of Dr. Miller. We will open up for public expression. I would like to remind the members of the public that this is for items not on the agenda, and we'll be limited to 3 minutes per person. Is there any public comment? Emmy, you put your microphone on. There you go. Please state your name.
This is Emmy Good, and I want to say that I'm going to read this because I know there's a 3-minute limitation. First, thank you very much for making it possible for the public to know not only what you are doing for Measure B, but also for allowing for public input. Because of this 3-minute limitation, I'm going to read this, and I'll probably read it quickly. A vision requires looking into an imagined future. We are in extraordinary times, and everyone's favorite word is unprecedented times. So now is the time for us to be setting precedents. What do we want in our local communities? What do we want in our county, our country, our world? What do we want and what do we need? Mental health has become a worldwide concern. Fear has impacted us all. It is now okay not to be okay. Perhaps the stigma associated with needing help for mental issues is gone, allowing us all to recognize our own and the vulnerability of all to withstand these challenging issues and to offer or ask for help and support. On January 21st, I and several interested community members had an opportunity to tour and photograph the old Howard Hospital facility. I had hoped to invite the Measure B Oversight Committee, the Board of Supervisors, and the Willits City Council to tour the site, observing the Brown Act, of course, as a location for a mental wellness center. At your last meeting, I shared my 3-minute vision of ideas, and I will still be happy to share it with anyone who would like a copy of it. It envisions using the 30,000 square feet in its park-like setting from the old Howard Hospital for services, treatments, and a wide range of support groups, classes, and activities that promote mental wellness. Let's look at that big picture county-wide. What do we already have? What can be expanded? Where do we want what? The words over people or property comes to my head. Let's use this crisis as an opportunity to try many innovative programs and possibilities. I do want to say that contacting people is very, very difficult. I sent out my letter with attachments for all these pictures, and they were huge files, and I'm not technical enough that I could really do anything except send them the way that I sent them. But apparently when you send things to mendocinocounty.org to the Measure B committee, I got bounce backs on almost everything. And I figure that either my files were too big or for whatever reason, they didn't go through. It may have been typos, it could have been a variety of things. So I know a lot of you didn't get the pictures. So if anybody wants pictures, let me know. Thank you.
Thank you. Any other
That's it.
further public comment?
That's it for
Allison,
me. Thank you.
Allison, please note that Ross has joined the meeting.
Sorry, I'm late. Sorry, I'm late.
Okay, no other further public comment? Sherry? Sherry?
Did you mean Shannon?
No, she's got her hand up.
Oh, sorry.
Okay, we lost her. Shannon, did you have something you wanted to say?
Thank you. Just a couple points of order. It's helpful if everybody who's not speaking has their mics on mute, and that'll help eliminate some of the feedback that people are getting. And then secondly, if we can, on future agendas, number 2 says public expression. If it could just say public expression on non-agenda items, that'll help clarify it. I've asked for that before, but it hasn't happened yet. Thank you.
Thank you. Okay, moving on to item 3A, approval of the minutes. Allison?
Okay, I am having trouble downloading it. Let's see, on my phone, of course I knew it was going to, I'm going to have to minimize you guys for a second and pull them up right here. So just give me about 2 minutes.
Can you hear me now?
Yes.
Sorry, this is the first time I've actually staffed one of our meetings.
That's okay. Did everyone read the minutes? I know you all did.
Absolutely.
Almost got it.
There was one change that I noted on page 4, last paragraph, first line, should be Member Miller and Member Allman. Does anyone else have any other corrections? Can I have a motion to approve the minutes? Shannon? Deb?
I'll make a motion to approve the minutes as amended.
I have a second.
Second.
Call off for vote. Dr. Barish? You can wave as a yes, thumbs up, yes. Okay, Dr. Miller,
Yes.
CEO Anderson? Yes. Commissioner Allman,
Aye.
Commissioner Ferretta,
Aye.
Commissioner Weir,
Yes.
Commissioner Myrtle,
Yes.
Commissioner Liberty, sorry.
Yeah, that's right. I must confess, I didn't read yet, so I can't say.
Are you abstaining?
I am.
Okay, thank you. We'll move on to item 3B, discussion and possible action regarding an update on the novel coronavirus, including essential services in Mendocino County, operational preparation and response, and update on county continuity, of operations and services and the need for increased mental health services due to the COVID-19 event. Commissioner Angelo.
Okay, good afternoon. Thank you. Let me just take about 3 minutes to apprise the committee. I'm sure by now everyone has been aware of what's happening and watching the news.
Hey, John.
Can you hear me?
I can hear you.
Okay, great. Okay, so it's actually been quite a few months that there has been a concern about COVID-19, the novel virus that has been impacting us globally. And sometime between November, December, January, we became very aware of what was happening in the Bay Area and had discussions with our health officer as the Bay Area was beginning to be impacted with positive cases of the virus. And then Humboldt County actually had a couple cases early on. And so since we had COVID above us and below us, and knowing that we move forward as a region, our health officer began to discuss the possibility of looking at making some changes within Mendocino County, specifically writing orders that would limit our mobility as well in order to protect the public's health. So back in March, we declared a local emergency here in Mendocino County. And that was declaring a local emergency before we even had a positive COVID case. And the reason that we did that was whenever you declare a local emergency is to let the state know that either you're impacted or you imagine being impacted soon. And then sometimes you just declare because it gives you the additional authority to take some other action. And then also it puts you in line for funding. So we declared back in March, and it wasn't that long after that we had our first case. So where we are today is we are living with a shelter in place order, which was a guidance and then became an order. And we are living with multiple guidances that are part of the health officer's responsibility in keeping the public safe. And so what's happened in the course of the last 6 weeks is we have had 5 COVID positive cases in Mendocino County. And as of today, there is only 1 that's still positive. 4 have recovered. The good news with the COVID cases is that they are all able to be traced. So they are all due to contact. None of them are due to community spread. And, you know, there is community spread in Humboldt, community spread in Sonoma County. There is community spread in Lake County. We have not identified community spread here. Community spread is bound to occur. It may be here now and we don't know it. The issue isn't so much community spread as it is uncontrolled community spread. And that's what we're trying to avoid. And that's why we have these health officer orders. So right now, some of you on the call are real familiar with what we're doing, and we are waiting until May 10th, which is the date that our shelter-in-place order is actually
John.
ends. And so I'm not certain, we're not certain what the health officer will do. We're also living under a statewide shelter-in-place order. So, you know, between the governor and the health officers in this region and our health officer will know going forward what will look like. So county offices remain closed to foot traffic. We do have 24/7 and emergency services. Many of us are working from home, as you can tell, that's what I'm doing as well. Our emergency operations center is open. We have a call center, and we're doing everything we can to respond to the public and keep as many county services going as we can. We do have employees that aren't coming to work because they have childcare issues, and they're certainly home taking care of their kids. We do have other employees that are impacted either with a family member or someone who is ill in their family and they're home as well. But for the most part, I think we are doing pretty good. Regarding the lifting of the shelter-in-place order, I have no guesses on what will happen, except that there will be some type of revision on May 10th. And when you talk with our health officer, as other health officers, there are 3 key points that come up when you think about allowing the public, the general public, to, you know, go back and move freely and try to do all the things they did pre-COVID. One of them is community benefit. So when you look at what will the future be, will businesses be open? Are there things we can do, activities we can do, activities we cannot do? What does that look like? Community benefit is a big issue as far as lifting a shelter-in-place order. Another key point is unlimited transmission. So basically, if it benefits the community to have a business open, like what's been identified as essential services, and by having that business open or that activity open, and it does not create this unlimited transmission, and you're able to do social distancing, those are 3 key points in lifting the shelter-in-place order. So at this point, we are in a waiting mode, waiting to see what the governor is doing. And the governor does a press conference every day at noon. Unfortunately, I missed it today, but I am hearing that he is focused on doing more testing in rural areas. And there is a correlation between doing more testing and lifting a shelter-in-place order. And so our hope is that we will continue to do more testing as well. We're at approximately 500 tests and 5 positives. And it wasn't long ago that we were at 250 tests with 4 positives. So we continue to do testing. We continue to do contact tracing. We're doing surveillance testing as well, which basically is testing a group of people that may be asymptomatic, but there is a reason to do that type of testing. So that's what we're working on. Again, you know, our hope is that we will have county offices open sometime in the near future, and we have not had any issues with 24/7 and emergency services not going out to the public. That has all been happening. We have a call center number that I think most of you may be familiar with, and that is 234-6052-707 area code. The call center has been open 7 days a week, and we do get a lot of calls, even from people that just don't know if a county office is open or not. They'll call the call center. Additionally, Dr. Miller has really stepped up with her staff to really respond to mental health issues. And Dr. Miller started a warm line, and that number is 707-472-2311. That is a non-crisis support line. So as we do what we can for public health and to protect the public's health, we're well aware that there is an economic downturn that has occurred We don't know what the future holds for the economy. We're not certain what will happen here and what will happen with a lot of our small businesses that may really be impacted by this. And we're also not sure of some of the other areas that we deal with domestic violence, family violence, child abuse, elder abuse, and of course, all things behavioral health. And so those are all areas that the county serves that are impacted. And at this point in time, I would like to ask Dr. Miller if she has any update that she would like to give the Measure B committee regarding mental health services and COVID-19. Dr. Miller?
Yeah, good afternoon. So I just wanted to give a quick update on some of the stuff we are doing in behavioral health, and just let everyone know behavioral health services has continued both from the mild to moderate perspective and the special mental health perspective. We have moved, I think, as a county, we are seeing that providers have really moved to telephone and telehealth, which has been an interesting change. Not a lot of mental health services in telehealth or telephone in the past. Psychiatry was one of the few services you saw a lot of telehealth options. So it's been a real change to the system, and also at the state and federal level for changing some of the regulations to allow for services to be done by telehealth and telephone. We are still doing some face-to-face, as Carmel said, especially in our emergency services, and as on an as needed basis. We are still out there serving the especially mental health clients. So if they need support to getting treatments or getting, we are still out there making sure those services are happening. And we are still drug testing. There's been a lot of questions on whether or not we are still providing drug testing for individuals, and we are still doing that, but we're really making sure we have social distancing and only calling one person in at a time so that we aren't exposing individuals or ourselves. So thank you.
Thank you. Committee comment?
I have one.
Yes.
According to RQMC, they were saying that their volume of crisis isn't up, but the severity of their crisis is higher. So I just wanted to report that.
Thank you. Jed?
Yeah, I'd like to hear a little bit more from Janine and anybody else about the nature of the mental health services and need that you're seeing. Because my experience with these kinds of crises, although we've never had anything quite like this, is that the stress levels go up, the emotional inner crises go up, job issues are causing economic things. So it seems to me as we respond to these, we need to get as accurate information as we can, as quickly as we can, of what really we're dealing with and differently than what we were doing before COVID. And Janine, could you say a little bit more about what you're learning from the warm line or any of your other people that are out in the front line seeing people, and what's changed and what if anything, can you tell us about what we may be looking forward to as this continues on through the weeks and months ahead?
So I think there has been a lot of changes, and I won't say so much in the special mental health world. I think a lot of those clients are really wrapped. That's not to say that they're not needing additional support, but if you were to ask me what I've seen change, is that I think we're seeing a lot of people who didn't have mental health needs starting to have mental health needs. And so you're seeing a population that neither the mild to moderate or the special mental health system is used to serving, starting to need more support. And when you talk about the warm line, a lot of times warm lines are volunteers that staff a warm line. I chose not to have our warm line open with volunteers. I specifically staffed it with certified, licensed, and registered clinicians, counselors, and staff who had been trained in 5150 assessments by, and it's all county staff. I chose to do that because I was worried about the high level of individuals that would be calling in on this line. And we have had suicidal calls on the warm line. We have a lot of calls. I would say 85% of our calls coming in on our warm line are individuals who are experiencing isolation, loneliness, depression, anxiety, individuals that probably have not used the mental health system before who are just needing support. And I know that there's talk about, I know Mika mentioned that, yes, crisis has sort of gone down, but the crises are more severe. That's kind of been statistically seen across the counties. The fear that we have as county behavioral health directors are that people are not going to the hospitals and getting help because they are afraid to go in and be exposed to COVID. So we actually have more fear that people are not reaching out to crisis. We think they're avoiding it because of the fear. And that's a bad thing because we believe we're going to see an increase in suicides and people that are going to need higher level cares because they're not getting care sooner. They're waiting till the very last minute.
That's great. Just one other quick follow-up question, Janine. In terms of your staff, the people that are working, kind of on the front lines, whether it's by phone or internet, or people that are actually going out in the field and seeing people and drug testing, all the other things that you're doing, do you have a sense of how much stress the staff is having in dealing with these things? This is a short time, but it obviously is going to continue to roll out as time goes on. I just wonder how the staff and the volunteers and just everybody that you're associated with, how are you all doing?
I would say we're doing pretty well. I think it's an amazing field in mental health, and they are very flexible and amenable. And I haven't seen the staff level in my staff per se. I've seen more of the concern for the community, making sure that we're still providing services, that we are taking care of everybody. The fear that if we're not here offering the warm line or doing treatment, what will happen for those individuals? So I think that that's more where you see the concern, is the concern for our community as a whole. We know something I didn't mention, but it is happening. We know there's an increase in alcohol sales. I think that's most people are probably seeing that. We're seeing it. We're seeing an increase in relapses also. So we know that that's also an issue that is happening across California and probably across most states.
Thank you.
Any other committee comments? Seeing none, any public comment, and I would like to remind people of the public to please mute your mics when it's not public comment time. And those that we cannot see, if you unmute, that will let us know that you want to speak. Thank you. Any community or public comment? Seeing none, we will move on to item 3C. Discussion and possible action regarding a recommendation from the Mental Health Treatment Act Citizens Oversight Committee to the Board of Supervisors to allocate Measure B funds from the services and operation allotment to local community-based agencies in order to support and extend current and local behavioral health services. Commissioner Angelo.
All right, well, thank you. This item is exactly what you said. And so let me start by saying that one of the issues that repeatedly comes up with the Measure B committee has been around, I think it's probably been 3 times now that the discussion has occurred about taking Measure B dollars and using them for mental health services in the community. And whenever it's come up, it has never passed. And that's just how it is. And I certainly see every single side of this issue. So understandable. This is a committee that has not even wanted to do a prudent reserve. So, whatever, that's how we've operated. This item here is solely in response to COVID-19 and what's happening within our community in Mendocino County. And this item is just me asking this committee to consider, yet one more time, taking $1 million of Measure B money that is slated for operations and putting it out into our community for mental health services. And, you know, we can listen to Janine all day long as far as what's happening within the community with mental health services. And I would guess that every single one of us knows of someone who is impacted by the isolation, by all of the issues that occur as far as whether it's stress from having children home at this time, being torn between work and raising your family with kids not in school, whether it's a sick family member or friend, whether it's someone we know that's not in Mendocino County, but another area that has died from COVID-19. I mean, there's not one of us on this call that has not been impacted in some way, whether we're sitting in our living room right now or whether our spouse is unemployed right now, whatever, it's all there. It's impacting, I would bet, every single one of us. So my request today to this committee is that this committee consider making a recommendation to the Board of Supervisors to take, and I'm just throwing out 1 million because it just seems like a good round number, $1 million. And I would recommend that that money go to the Community Foundation. And I say that because since 2017, the fires of 2017 and 2018, 2019, we had a public safety power shut off. And now in 2020, of course, we have a virus. And the Community Foundation has stepped up every single time. And they have managed money. They have collected money. They have just distributed money. They have worked as a good partner for Mendocino County, along with NCO and some others. And I would recommend that the Measure B committee make a recommendation to the Board of Supervisors to take 1 million of operational dollars and give it to the Community Foundation. And the Community Foundation would do a process that would be an application process. And those community-based organizations out there that are serving our mental health clients and also are serving everyone when it comes to mental health issues, that they would have an application process and they could apply for some of the Measure B dollars through the Community Foundation. The Community Foundation, because they've worked with us for many years now, and they also understand FEMA and FEMA dollars as well and reimbursement, that they would work to make sure that the application was very brief but complete, and that there was also documentation on the services. And the reason the documentation is important is there's never a guarantee when you're dealing with FEMA federal dollars. But one of the successes that we've had already has been that we did an expedited billing for FEMA right now. And we got an approval letter within 2 weeks that FEMA was giving us back or reimbursing us $750,000. So my point is that it's quite possible that if the Measure B committee actually moves forward with making a recommendation to the board to take $1 million, give it to the Community Foundation, have them go through an application process, proper documentation, the money goes out into the community to help support serving people with mental health issues right now, that there is a good chance that some of that money could be recovered from FEMA. There's no guarantees, and I could never guarantee it. But certainly, if we can, we will. So that's it. You know, I don't have a dog in this fight, except there's people out there that need help. And we're sitting on millions of dollars. And, you know, that's just my request. And Chair Muschetti, I have a 2:00 meeting with the state. And so I'm short on time. That's my item today. Except I would ask Dr. Miller if there's anything she would like to add.
Yeah, I'd like to add just a quick thing. I wanted to add, in doing a lot of research, Jed, some of it I answered your questions regarding what are we seeing in our community. And I think that what we are seeing, it will get worse over time. And I think, as we know in the mental health field, that what we experience now, we go into this form of, like, you know, there's an adrenaline rush and we're dealing with it. And then as time goes on, it really hits us. So we know maybe what we see today is not what we're going to see tomorrow. And I would say that it'll be worse tomorrow. And that's usually the way that we see things. It's when we come down that we see our impacts. And looking at just what we know, we're experiencing trauma. Everyone that's going through this at one level or not is experiencing some form of trauma. There's a fear of illness, a fear of death, and the fear of uncertainty of our future. So we know all these things will impact us all and will impact us long term. And as we come out, depending on what the economy looks like, we'll have that additional impact. But in looking at some of the research, we know that back in the 18th and 19th centuries around pandemics, that there is an increase in both insomnia, anxiety, depression, mania, suicidality, and delirium. So, and this is scientific stuff that we've been looking at when we look at the pandemics that have happened in the past. What was the outcome from those pandemics, and what did our communities look like? So I think it's something we need to prepare for. We need to know that this is a possibility. I think doing prevention and early intervention and spending the money now to create a prevention early intervention is going to save us and not have to not see a lot of people needing higher levels of care because we're taking care of them today. We know today that there's an increase in domestic violence. So that's just one of the things we know. There's an increase in alcohol sales. There's an increase in relapses, and all those things can tie sometimes into mental illness, mental health. And I see this as a smart move to create a prevention early intervention early and get the people help that need it. So thank you.
Thank you. Committee comment. Dr. Barish.
I would like to just mention that working in the hospital, I've been very surprised at the diminution of numbers after seeing these videos of the hard-hit areas by COVID-19 and how busy they are. It's been quite the opposite locally, and the census is down, the emergency department visits are down, practitioners can't see patients very easily, although they're beginning to gear up their telemedicine capability. But there's a huge economic impact on the hospital that I've been very impressed with. And my understanding is a similar phenomenon is happening with mental health, that there is a financial deficit right now due to the COVID-19. And on the basis of what I've seen, I very much favor this motion of Ms. Angelo's to help shore up the current system.
Thank you, Commissioner Allman.
I certainly agree that there's a need, but I am vehemently disagreement of the source. Measure B is to build brick and mortar and to improve mental health services. And as much as I support the community foundation, and I do, I see us going against the voters' wishes to give any amount, whether it's $1 million or $500,000 to a non-government organization without knowing if it's going to improve mental health services. And of course, there's increase in domestic violence, and the sheriff's office has taken the impact of the cost related to the homicide of the domestic violence and responding. So I'm not going to disagree with the need, but I would encourage the Board of Supervisors, if they believe that there's that need out there and they believe they can get the 75% reimbursed, then they could take it out of reserves or someplace. But we know that when we open a PUF, whether it's in 2021 or 2022 or 2023, the cost of running that PUF is going to be high. And the money that if we took $1 million out of our account now, and we do have millions, but if we took the money out now, I think we would be regretting it after the first year of running a PUF and saying, we wish we had that money to run our psychiatric health facility. Thank you.
Thank you. Shannon?
I think there might have been somebody before me. Are you sure I'm next? I'm happy to go. No? Okay. Thank you. I agree with Member Allman on this one. I appreciate the need. I have a ton of respect for the Community Foundation. I'm concerned about the lack of detail in this request, the lack of a specific plan. We've talked numerous times about our concerns that there may not be enough money to do what we already plan to do, to build facilities and have this training program. Financial experts are estimating a 20 to 30% hit in sales tax revenue over the next year. We're going to be working with even less money than we thought we were. This feels like supplanting the system. If we get farther down the road and we determine that there is a very specific need that we can discuss in detail, I'm happy to revisit that. But at this point, there's not enough information. This feels like just throwing money out there, and I'm not disagreeing that people need this, but there's a lot of needs out there right now, and I think this is not what we were set out to do with this money. So I don't support this at this time.
Further committee?
Hey, Donna, this is Lloyd.
Oh, sorry, Lloyd, go ahead, and then Jed.
Yeah, I would just like to state that, I believe we've asked for a financial plan on how to staff and fund what we're building. That's probably a ways off. We're not there yet, but I'm a little concerned that we're going to maybe use operational money here that we may need to run the facilities that we plan to build. So short of a plan that shows that we can afford to do something like this, I'm not going to support it at this time. Thanks.
Jed?
Yes. So I want to speak to this in a couple of ways. Some of you know I've worked in mental health for a long time. All these gray hairs kind of remind me of that. It's actually been 50 years now. The other thing that I think some of you know, but not everybody, is I went back to school and I got a doctorate in international health and studied pandemics and infectious diseases, and not this one, obviously, this is a new one. But my thinking is this, when I look at where we are, and I listen to Janine, and I have clients who are going through a lot of these things. I continue to see people. And my conclusion is this: I think we're in a totally different world now since the COVID-19 virus has swept the world. And clearly the health system and the medical system all over the country and all over the world was blindsided by this. And everybody's catching up. Everybody's trying to figure out what to do. As Ace said, locally, we haven't seen major people in the hospital, but as he knows, and I know from my studies, is we're all linked together. So the fact that we haven't seen the worst yet doesn't mean it isn't still coming. And as Carmel said, we're preparing for the worst. Hopefully the worst won't happen. The other thing is that it speaks to what we've been doing with both the funding that funded Measure B and the priorities that we set out ourselves to do. And speaking to what Carmel said, from my perspective, I don't think the reason that we hadn't considered putting money into community wasn't because we didn't believe in community support of mental health. Part of what we all know is we're not supplanting with Measure B money what's already in the mental health. But we spent many months to develop priorities that included a hospitalization, included emergency. And we set some priorities out, and we wanted to be sure we have enough money to do that. And I supported that. I think we all did. And the Board of Supervisors has approved both the priorities and some of the funding for some of the things we've recommended. But here's what I'm concerned about. And it speaks, I think, to what Carmel's bringing up and what Janine has said, is if we in fact are in a different world than before, and I think we are, I think we need to really relook at all of our mental health priorities that Measure B has come up with. And I don't think we necessarily are going to say we shouldn't do the things that we had set priorities for, but I think we may in fact find that the priorities that we had beforehand, in the light of what we're seeing now with the present stresses, not just from the virus itself, but from the stress of it, from the economic impact that it's going to have on the community and the mental health stresses that brings, we may in fact have different priorities. And at least for me, and I'm, just one member of the committee, I'm feeling like it would be important for us to relook at our priorities for the same reasons that Shannon and the sheriff have mentioned. Past sheriff, sorry. I guess I will always see you as the sheriff, and maybe there's more than one sheriff in town. But in any event, the priorities that we set out, we may want to have that money available for other things now than we thought we might need beforehand. So that's, for me, a reason why I think we ought to look at the priorities and relook at our priorities in light of, hopefully, more information that Shannon and others would be bringing about what mental health issues we're seeing now and what mental health issues we may be facing. And let's face it, there's a lot of uncertainties now that we didn't have beforehand. We don't know what we're going to be facing. And I think there may be some value in being able to keep our money available so that we could speak to either priorities that we already had to be sure that we can do them if they're still priorities, or to change our priorities as we move ahead. That being said, I think there's also a potential need for emergency services, just as emergency services in hospitals are necessary. There may be some emergency services right now that we need to put some of our money into those. And I think we ought to look at those things. Carmel put out a potential use of some money. My feeling is we're going to need some money for emergency services in mental health now that I would like to see us take a good look at and perhaps use some of our money for that after we take a look. And my final thought about this is that, and it ties to what I've said already, is that we've talked a lot about community desire to get money working now. Let's get some things going now. And I think the training center turn out to be the most important money we've spent and the most important priority, because I think the truth is we're never going to have enough mental health people to take care of everything and everything that's coming our way. I think we're going to need to train people. And I think the fact that we have a training center up and running, that it's going to be beginning to train now that we're doing training online, as we're finding we're doing now. I think that may be, the immediate things that we can start doing right now. And there may be a need right now to fund some immediate services for both the programs that are out there that are operating now and are, maybe are going to be needed and needing some funds to keep going. So they're not one of the businesses that goes out of business and we end up losing services. So I think these are important issues. I'm glad Carmel, brought it before us. And, I think we ought to look seriously at all of that, relooking at our priorities in the light of what we're seeing with COVID, getting some real specific detail about what the need is, and considering perhaps some emergency things now and maybe some long-range change of our priorities, if it looks like that would be the desire of our full committee, and obviously the desire of our Board of Supervisors as we make our recommendations. So those are my immediate thoughts at this time.
Any other Mika?
Yeah, so I'm torn on this one because I really, I kind of support everything that's been said by the members. One of the things I want to kind of try and figure out is, we do, it sounds like from the BHAB meeting that we need to stabilize the current mental health system of care. And Janine can speak a little bit more towards that. She did address a 25% decrease in funds. And when I did hear that, I immediately thought, oh, well, Measure B does have some money set aside to support, current mental health services. Or maybe I'm wrong, Alvin. You guys can kind of help me out through this. So I think that, I don't want to withhold money and have people get worse, have their mental health get worse while we're in the planning stage. But I also want to make sure we use the, money effectively. So maybe Janine could talk a little bit about that 25% decrease in funding for the current mental health system. Janine, could you speak to that?
Sure. What I can say is, because nothing's set in stone yet, as we all look at where we're going, and I think both Carmel and Shannon both mentioned that we know we're going to take a hit. And right now, our projection in mental health, because we are going to take a hit in our 91 realignment and 2011 realignment, and also the Mental Health Services Act, the projection is approximately a 20% hit over the next 3 years, at least, with a lot of thought that we won't be stabilized again for 5 years to back to 18-19 levels. That is obviously that nothing is set in stone. It's an estimate based on financial experts that are looking at where we are today and what they're projecting. But when we did meet for the Behavioral Health Advisory Board meeting, we do have to talk about what is our financial look for the next 3 years as we look at especially mental health services, and what does that look like for the long term as we're looking at what we're hearing from our experts on just our financial look for the next 3 years in both our realignment dollars and our Mental Health Services Act dollars.
So that's kind of where I get to, how are we going to stabilize the current, especially the adult services that we've gotten underground and on the way, and is this the right way to do it? I'm open to that discussion, but I think that holding a reserve for the future, there might be, it'd be great with our facilities, but how severe do we want, as the mental health crises get more severe, that early prevention is always a better way to go. So do we use it, do we do this now or do we wait? That would be my comment.
I don't have a way to raise my hand, so.
Ross, is that you?
That's me.
Okay.
Okay, thank you. So I, reading the initiative, it's I come to, or the initiative, the agenda item. Support does not necessarily equal supplant, and we have to be careful about that because I think we're all on board with that's not our goal here to supplant other monies, but we voted 2 months ago to support increased services. That kind of my reason for bringing that forward was we wanted to, all the brick and mortar stuff seems to be pretty long term, and we needed help now, and that's consistent with Kemper report where he indicated he thought it was possible to reduce some of the loads on a PUF or whatever by 50% with more kind of front end services. So I do share Shannon's view that it's a little scary because the agenda item lacks specifics, I guess, as to its use. But to move, we have a lot of, I mean, we're really in a crisis stage and we don't move all that fast. And maybe sometimes you got to go ready, fire, aim. And this could be one of those times. Although I like to think of myself as a fiscal conservative and I want to be really careful with taxpayer money. But I mean, this is a crisis. I mean, this is a crisis of all kinds of magnitudes of financial crisis, a health crisis, and a mental health crisis. And I'm sort of torn because I don't want to be in a position of supplanting monies, but we need to improve services. We need to make sure that we improve. Our goal is improve services. Well, the current services are probably going to be in big trouble, and it's hard to improve them if you don't have a good baseline, stable baseline to improve from. So that's kind of my 2 cents. Thanks.
And I'd like to call on Commissioner Angelo as she's going to have to leave this meeting.
So Chair Muschetti, thank you. I would have to say in 26 years of government, I don't know that I've been in a position where an item has been brought forward. The person who brings the item has to leave the meeting and the item is not complete. There hasn't been a vote. So I am not sure how to proceed. I actually am considering pulling my item. One thing I can do is count, and we have 11 people on this committee. I don't see 6 votes for this item. So I don't know if you would like to go to public comment and then I pull my item, or what your pleasure is, Chair.
So you are going to pull it?
I don't know. I'm sitting here thinking that, I don't know if it would be better to just pull it and, or we can just take a vote. I mean, do public comment, we take a vote and we're done with the item. I think that it's a very polarizing item. You either support it or you don't support it. And I do understand the issue about feeling like there's not enough information. I totally understand that. And I think that in a period of 6 weeks, with what we've been dealing with, I understand why, why someone would think, I mean, this money, we have really tried to protect the Measure B dollars for all the right reasons, but honestly, going forward, if you think about this, I think we projected $38 million. I don't know how we bring in $38 million over the next 4 years at this point with, with the economy the way it is. I don't see that happening. So, a decision for this million may not make so much of a difference as the fact that how much are we really going to bring in over the next few years. So I would respectfully request that we go to public comment, and I can leave the item on. We can go to public comment and take a vote and then call it a day on this one. Thank you.
I would like to speak. I don't know how to raise my hand either. This is Mark Myrtle.
Go ahead.
There's one thing about these kind of times and acting and reacting and I try not to make decisions when acting emotionally, and we're under a lot of duress, business-wise, every aspect of our lives. But I agree with what Lloyd said. I think we want to be spending millions of dollars with a plan, not an emotional reaction to a pandemic. And we have pretty clear direction in the Measure B language about what we're spending that money on, and that's building facilities and supporting those facilities with services. And like everyone has said, we may not have the $38 million that we thought we had. We shouldn't be spending that money on things that we don't know where it's going. That's my opinion.
Any further committee comment?
I have one.
Yes.
Would it have to go to the community foundation? Is there a way to sort of monitor it? Not the best way, I guess, is what I would be asking, Carmel, because I do really want to make sure we're stabilizing our current system, because I don't like the idea of withholding money that we have while people are suffering and getting worse. That's really my concern.
So, Chair Muschetti, my motion was to put the money out into the community for those that provide services. So if that's what you're asking, Mika, that was my motion. And I want to be real clear on something, because certainly, things get misconstrued. I repeat, I am not asking for Measure B money for county to go into the county budget. I am absolutely not asking for that. This is money, and the reason I'm saying the community foundation is, one, we work with them and they understand the process, they have a process, and I think it's very fair that any organization out there, whether you're a community clinic or whether you're one of our mental health providers, could apply for the money through the community foundation. So that's the only thing. Again, not asking for this money to go into the county coffers. I would never do that. I'm not doing it. I would pull it before that recommendation got to the floor.
Okay, so some of our service contractors, like for instance, like Manzanita or something, they would, if it was in the community foundation, one of our current organizations could apply for it. Do I have that right?
Yes.
Okay. All right. Thank you.
Thank you.
Any further committee comments? Jed?
Thank you. There seems to me to be two aspects, Carmel, of what your motion is, and I just want to be clear about it. One part has to do with bringing to the fore an amount of money that would go to community programs that are helping the mentally ill. The second part of it has to do with how that would be decided and distributed upon. And you mentioned the community foundation. I feel some resonance with what you're saying, what Janine was saying about the immediate need for money to go for mental health services. And I think that is within the purview of Measure B. It isn't clear to me whether having it administered through the community foundation, I don't know them, real well, but just on the face of it, I would be reluctant to support Measure B money going to somebody or any organization where Measure B committee didn't have any say over how that money would be spent. So that's the part I would have some concern about, and I wanted to be clear whether your motion or your recommendation that you're bringing before the committee for a vote potentially is the community foundation part of it. Is that necessary? Is it's got to be through them, or might there be some other way in which the Measure B committee would be more directly involved in what the needs are and where that money would be spent if it were approved by the Board of Supervisors?
Chair Muschetti, if I could answer that?
Yes.
Through the chair. The only thing I would say is that if you leave the money in the county system and have the county put a process together, it will be 3 months before this money goes to the community. Not to be emotional, however, I would say that at this point in time, we have people that are struggling right now and that are struggling with mental health issues. So given another 3 months, I mean, we'll still have people struggling, but I would, there's lots of ways to do this. This committee could do whatever it wants. If there's 6 votes on this committee to give it to the community foundation, they could also put together an ad hoc to work with them, which we've done in the past, to actually set the parameters. You're not going to have someone outside of let's say Dr. Miller, who is our subject matter expert, just turning it over to people who don't have that experience or expertise in mental health services. So, I mean, there's lots of ways to do this. And, the point was that, again, I think this committee has talked about certainly putting money out, and it is a polarizing issue. So my point to you, Jed, is that there's lots of ways to do this. There's only a couple of things that I'm wedded to on this item, which is my item. One is that, whether it's $1 million or whether it's 800,000, whatever, $1 million out into the community to provide mental health services, and that it is a very fair way of determining where that money goes, that whoever gets that money has to document well so that we could attempt to get FEMA reimbursement, and that the services that this money would pay for would go to the people that need it. I would agree with somebody who talked about supplantation. It's not supplantation because it's not taking the place of county dollars or federal dollars or anything like that. But anyway, nevertheless, there's lots of ways to do this. But again, I think it is a polarizing item. So Chair Muschetti, that's all I have to say at this point. Thank you.
Ms. Riley?
Thank you. Again, I appreciate the need for this. I have no doubt in my mind that the landscape of our community, of our medical system, of everything as we know it is going to look significantly different after this. Measure B, in my mind, is not a particularly flexible source of funding. This was voted on by the constituents for some very specific purposes. We subsequently did fairly expensive analysis and needs assessment and adopted a budget. And this particular item is not in either of those things. So what we're talking about is a pretty major diversion from what we have very transparently adopted as a committee. So that's my concern about this. I would welcome a future item that had additional information and a specific plan for it, included with a financial analysis that incorporates our original plans. But this potentially compromises our original plans and what we adopted before. So those are my concerns.
Thank you. Any further committee comment?
Chair Muschetti, if you could please go to public comment, because I would like to call for the vote.
Certainly. Public comment, please. Sherry.
Hi, I'm Sherry Abiyam. Can you hear me?
Yes.
Yes?
Well,
okay. Thank you. So my comment is comes from a budget place, and I have a lot of questions. How could the committee possibly be able to make a decision about this without seeing an overall budget for Measure B monies? What percent of $1 million is the operations? Yeah, what percent is $1 million of the operations budget? And what was the operations budget originally earmarked for? And what adjustment would be made to that budget if $1 million was suddenly taken from it? So that's one comment. The other part focuses on the county's prudent reserve. Every county has a prudent reserve mandated by the state. And it's typically, my understanding is it's a percent of your overall budget. If the county's overall budget is $300 million and it had a 3% reserve, which is really conservative, that's more in line with school districts' mandated reserve. That's $9 million reserve that's sitting there. That money's available today. If the budget is $250 million, 3%, $7.5 million. So there is money available there it's a prudent reserve, but it's a reserve for times that are extraordinary, such as this. I heard the comment about a totally different world. I'm sure that the county is working on the 2020-2 2021 budget. And that would be the time to see that this budget reflects this totally different world that is not going to end in 5 seconds. So I'm really, my comment is to be very hesitant about using Measure B monies that were voted on by the voters for a specific purpose, not take it out of the purview of the county or the committee, and turning it over to the community foundation, focusing on the county's prudent reserve as a resource for funds that are definitely needed. But that would be my suggestion as to a better place to go for that money. Thank you.
Any other public comment, please? Emmy?
I know Carmel has to go to a meeting, so I'm going to make it very fast. Thank you, Carmel, for at least bringing this forward. I think that these are extraordinary times, and having some flexibility or looking at how we can get services to people is really important. But I also have had a long-term relationship with the Community Foundation, and they are really good at being able to set up and administer things. And I know they would do it within a cooperative venue with you folks on Measure B. But thank you for taking this one on. That's it.
Chairperson Muscati, this is Camille Schrader.
Okay, go ahead.
Just 3 points. One, this committee has been talking about community services and community programming being put out into the community for quite some time. So I think it is in the purview of part of what the statute was. It wasn't the primary. The primary was facilities, but I know that in previous meetings that's been a conversation. 2, unlike the other issue, this is not supplantation because it's talking about community health and community mental health, i.e. child abuse, domestic violence, severe anxiety, depression, and community isolation that are absolutely off the charts. And 3, this is a one-time ask. It's a one-time $1 million operational commitment to something that does feel like it's in the purview of Measure B. So in the future, those dollars continue to roll to the degree that the entire economy does something to support the facilities once they're built. So those are my thoughts. I think this could go a tremendous way to help support our general community members, not just our especially mental health people. And Community Foundation has done this with the fires. They've done this with other very severe things, worked very closely with the county. And I too believe they can provide the kind of transparency, accountability, and administration that this committee would look for. Thank you.
Further community comment?
Can you only say it once?
Yes.
Can you only talk once? Yes, okay.
Oh, sorry, anyone else in the community? Seeing none, any further committee comments? Janine?
So Donna, I just wanted to add one thing here. We have talked about on this committee since we started, and Kemper did report for us about spending money on MOPS. And we haven't spent that money. And if we look at, had we spent that money, well, in the years we proposed to put it forward, it would have been about $1 million. So I don't think we're so far off of that same number as we projected to spend on MOPS. We haven't spent money. We did not go forward with MOPS. We have this money now to do something that our community needs. And it's money we would have spent on MOPS programs. If I remember right, MOPS for a year was $550,000 approximately. I think that's what it was. So I think it's $1 million we would have spent by now that we haven't spent. And I think it's definitely needed in our community. And so I just want to remind, when we say that we couldn't spend money on services, we propose to spend money on services and to expand our MOPS teams. So this is similar, but I actually think an outside unique box that we've never looked at and something this community could really benefit from.
So,
Okay. Thank you. Any further committee?
Chairman Betty, I'd like to call for the question, please.
Okay, Allison, could you please read, well, actually, would you like to make your motion?
Yes, I would like to make the motion. And my motion is that the Measure B committee make a recommendation to the Board of Supervisors to allocate Measure B funds in the amount not to exceed $1 million to local community-based agencies. These funds would be allocated from the Services and Operations allotment and would be used to support and extend current and local behavioral health services which are being impacted due to COVID-19 event. The funds may be reimbursed to Measure B in the event that there is federal COVID-19 funding available. And that is my motion.
Do I have a second?
So Donna, I would second that, but if I could get Carmel to add on to that, just that the Community Foundation will work with an ad hoc committee from Measure B.
Yes, I will add on to that. Additionally, the Measure B committee will form an ad hoc committee to work with the Community Foundation to develop a priority process and evaluation of the community-based organizations receiving the funds.
Do I have a second?
Second.
Okay, Allison, will you run through the members, please, for a vote?
She's on mute.
You're
Allison,
on
you're
mute.
on mute.
Okay, here we go. All right, Jadonna,
Yes.
Janine Miller,
Yes.
Shannon Riley,
No.
Tom Lallman,
No.
Vika Ferrata,
Yes.
Ace Barish,
Yes.
Lloyd Weir,
No.
Mark Myrtle,
No.
Ross, I'm blanking your last name, I'm sorry.
Liberty, like the statue.
Thank you. Ross Liberty.
Yes.
And have I missed anyone?
I get to vote?
I don't know. Do you get to vote? Yes, Carmel Angela.
Yes.
And myself, yes.
Okay.
So the measure passes
Chair
7-4.
Chair Muschetti,
Yes.
in order to expedite this, I would respectfully request that you as chair choose an ad hoc to work with the Community Foundation on this so we could get it going rather than waiting for next month. You have the prerogative as the chair to choose an ad hoc. And I would suggest that you look at the no votes and have at least one of the no votes as part of the ad hoc, please.
Absolutely.
Thank you.
Thank you. Okay, moving on to, and I'm assuming I can do the ad hoc outside of this meeting. Is that correct?
No, you should do it in the meeting.
In the meeting. Okay, so whom would like to be on this ad hoc committee? Sorry, Jed, Janine, on the no vote, that's 2. We should probably have 3, 4.
Well, 4 would be good. It doesn't look like any of the no votes are willing to be on the ad hoc.
Oh, I
though.
haven't asked them.
Okay.
Any of the no votes wish to be on the ad hoc? No?
You're muted.
Sorry, I have Jed and Janine. Anyway, Christian, did you? Oh, he just joined on. Anyone else? So I guess it defaults to me. That would be 3. If anyone else would like to join, please let me know. Moving on to item 3E. Discussion and possible action of potential additional creation of regional behavioral health training facility ad hoc committee group. Provide direction for this ad hoc committee to formulate a regional and/or county enhanced training program and training schedule for the regional behavioral health training facility. Shannon.
Thank you. This is an item that we've actually discussed at least a little bit a couple of times, and it just kind of got pushed from the last meeting. So I'm not going to say a lot about it other than the fact that, we committed to the development of this facility because people felt like it was needed. I don't want to see this become a $500,000 conference room. If we're going to spend the money on this facility, I want to know that we're actually improving services and we have a training program that goes with it. So I believe there were a couple of people who were interested in working to develop that training program. That's not my area of expertise, but so I'm not sure what work has happened between the last meeting and this meeting on that item. So that's just a quick recap, but I'm happy to answer any questions or elaborate further if people would like.
Mika?
Yes, so this actually was an item that I feel strongly about as well, and it didn't quite get on our Behavioral Health Advisory Board agenda correctly, so I would like to take it back to them. I'm fully supportive of trying to create an actual program so that we can see what we have, and I think that's important. And I do know that Wind from Manzanita has some expertise in this area, so I'm trying to figure out how we can all create this. I think there's a lot of things in place already that we could just get on paper. But like I said, we didn't quite get it right on our agenda on the Behavioral Health Advisory Board this month to see if they wanted to participate. But I do want to see this item get some traction and move forward. I think it's important. And I would like to see, I know Janine does have some training schedule and Alman does as well. So if we could maybe just even start from seeing what those programs are, I would like to see that.
Any further committee comment? Mr. Allman?
To the chair, who is on this committee, the ad hoc?
That is what, thank you for bringing that up, because I was just going to ask that myself afterwards. We need to form the committee if we're going to have one, first of all, and a way to run it together, in my opinion, Mika, is when you have your ad hoc meetings, whoever's on this committee asks stakeholders for what they envision the training center to be, and you'll get a more comprehensive vision, I believe. And there was also talk on this. I believe that it may also be appropriate to add this committee to the existing training facility ad hoc committee. I believe there's 4 members on that. So we'd have to be very careful with that and only adding 1 more member if we were to combine them. I don't know if that answered your question, Member Allman.
At the last meeting, Chair, someone identified Dr. Miller as the chair of this ad hoc. I don't think the chair has ever been identified of this ad hoc, and that would be in your purview. Do you have a preference of who the chair is?
This one that we're talking about now would be a probably a separate ad hoc, but it said if the ad hoc is created, which we haven't done in answer to your question, it may also be appropriate to add this committee to the existing training facility ad hoc committee. So this committee technically has not been formed yet.
And I agree, we just need to watch our numbers to make sure we don't get.
Exactly. As I said, if we combine, we would only be able to add one more to that committee. So Member Riley, if you don't mind really quick before I go to Jed, do you have a preference on that portion of it?
I don't. I think, whoever is passionate about it and has the expertise, I wish I could help in this area. I feel it's really important, but I just don't have the expertise to lend to it.
Perfect. Member Diamond?
Yeah, it seems to me that we don't need two different committees. So the idea of having a single committee, and I don't recall who was on the first committee and what the charge was of that group. And if you could remind me, and then maybe you could expand the charge and add more people if you needed to. But I've forgotten the original.
You're great, because I know it was Mark and Janine. Excuse me, I shouldn't be using your first names. Commissioner Miller, Commissioner Myrtle, Commissioner Allman, and I don't believe, did you have a fourth? I have to be honest, I'm not positive on that.
Yes, Mika.
I think it's me.
Mika.
And just to be clear, I was going to take it to the Behavioral Health Advisory Board and see if they wanted to have an ad hoc to help out, but that didn't get on our agenda last week.
Okay. So we have Member Allman from the Public Safety, Member Miller from from the Behavioral Health Department, Member Myrtle, and Member Mika, who is from the Behavioral Health Board. If you would want, we could add one more person. I think public safety should be represented. I think mental health should be represented. And it's possible that, Member Myrtle is just a member of the community. It might be a good ad hoc as it sits with the possible addition of one more person. That's just my opinion. It's up to you, folks.
I'm satisfied with where we are, Chair.
Anybody else? Do I have public comment? Seeing none, I do not believe we need to vote on that particularly, do we, Counselor?
Sorry, trying to unmute. No, Chair can make the appointment.
Perfect. So be it. And you guys didn't catch me, and it wasn't even my item. I totally skipped over because I was doodling on it. Item 3D, discussion and possible action regarding requests to the Behavioral Health Advisory Board to provide recommendations on prevention and early intervention service gaps and possible programs that could be funded through Measure B. Mika.
Yes, that did get on our Behavioral Health Advisory Board, and we have formed an ad hoc committee to address this issue. We have yet to have a meeting, but we're going to try and come up with a strategic way to do an analysis of this. I would like to say one of the service gaps that I'm immediately seeing and experiences is the lack of strong internet connectivity in a lot of areas. And as far as using the Zoom and the teleconference and telemedicine, if you're in Ukiah or right in Willits, you will find anywhere else. It's just impossible. And I do know my own little pitch is that, we do have that fiber optic line that runs all the way to Eureka. And one of the strongest T1 lines is in Laytonville at the old Bailey's building that has really good internet there. Otherwise, it's literally impossible to have any video conferencing or chats outside. So I'm going to say that's a service gap that's very noticeable and extremely frustrating. It's great here when it works, but when it doesn't, it's impossible.
Thank you. Any committee comment on the update? Seeing none, any public comment? Seeing none, we will move on. We will now skip E, which I skipped ahead to beforehand, and thank you, Member Miller, for letting me know I did that. 3F, discussion and possible action from the Regional Behavioral Health Training Facility Ad Hoc Committee regarding update of outline plan describing relevant details of allocated funds to finalize improvements to the Regional Behavioral Health Training Center before expenditure.
Can I go?
Yes.
So I think that we're going to have a representative from that Allison has worked with who's going to brief us. I hope he is. The training center sits as it was when I finished the painting, but the carpet is in, the kickboards are in, and I see the tables and chairs have been delivered. And so we have, Allison, can you brief us to what is going on?
Sure, absolutely. So we have been assigned an architect named Jim Lacey, who's going to join us on this call, but I think he's just going to actually join us in the upcoming ad hoc meeting. But he has been just working on and checklists, making sure that we're ready to take a look at the parking lot restriping when we're ready for that, and also the interior and room will look like and consist of just really I'd say the last little 10 things that need to be done in order to make that place what it needs to be for the next decade or two for us. So he's doing a great job and has a clear understanding of where we're going, and also how to identify costs one at a time, so that we're not completely storing our budget. So things are looking good.
Member Miller, anything to add?
I would just add that Allison covered most of it. We did, behavioral health is purchasing a screen, a projector, and a smart board for the training center. So we're in the process of finishing that purchase that will be given to the training center from behavioral health for everyone to use. And so we're in the process of getting that. And we are setting up our next ad hoc committee meeting.
Perfect, thank you. Any other further committee comment? Excuse me, Jed, please.
One thing I'd ask and one thing I'd comment on, the comment is, as we're doing more of these Zoom calls, and we may be doing one for our next meeting, I think it's important that we be able to see and hear each other to the best of our ability. I noticed, Allison, your video, at least for me, would freeze at times, or your words weren't clear. So whatever we can do to help whatever connections you have, I think we ought to do, or anybody else. Mika was talking about the differential way in which we connect and can be heard and seen around. So I think we ought to try our best to be able to up our level. And the question I have is the training center. Obviously, the training center, I would hope, would have the highest level of broadcastability and whatever in terms of fixing things up. And I'd ask the committee or Tom, is that happening in terms of whatever kind of internet connections you need to be able to broadcast at the highest level you can?
Well, through the chair, we've put in for that request. I don't know if it's been installed yet, but it is in the initial plan. So it's because the sheriff substation's there, they're going to do the same thing.
Right.
Also, but it's going to be a shared cost. Yes.
Thank you.
Man, any further committee comment, please? Public comment? Hearing none, we'll move on to, I'm sorry, who's talking?
I asked you
Did I miss something? Okay, item 3F, discussion and possible action from the regional behavioral health
maybe there's a
training
delay.
facility ad hoc committee regarding update and outline plan describing relevant details of allocated funds to finalize improvements. Regional Behavioral Health Training Center before expenditure. Member Miller. Did you guys all hear me? Yeah, okay.
Yeah, somebody was trying to speak over you. I think we may have missed somebody from the last comment that was trying to get in.
I think Allison is trying to, I could be wrong, but I think it was Allison trying to add some information. And I think 3G she was going to be speaking on.
Yeah, Allison's connection is not good, clearly.
She's frozen right now.
Yeah, I think she's frozen.
I was just stating that
No, she's frozen.
Hey, Allison, turn off your video because it's taking up too much bandwidth. Turn off your video and then we'll probably be able to hear you.
Okay, so Allison, are you with us now? Well, we knew there were going to be a few issues. So I'm.
Okay.
Huh. Allison, are you there? So I know the members of the public probably do not have, we are on 3G, correct? So I know that members of the committee have the summary of request and background information.
Yes, I'm sorry.
So,
okay, how am I now?
Kind of, sort of.
Allison, can you talk a little and see if we can hear you? So while Allison tries to get back on with us, I know all the members of the committee have item 3G in front of them. We could maybe field questions for Allison and bring it back when she comes on if there is any comment regarding item 3G.
Okay, can you hear me now?
There she is. Never mind. 3G, Allison, it's you.
Okay, excellent. That's some important stuff for making sure that everybody knows what we're doing on paper, or at least in the cloud. So I already spoke a little bit about what's happening with the training center, though I don't know if any of you could hear me, so I'm just going to revise, or repeat rather. So we are getting really close to getting to the point where we can put designs on paper and get that to the ad hoc committee so that they can say, yes, I like the striping here, that that ADA access looks good, or approving the break room, things of that sort. Very close. And and as we get more into that, that means that there will be expenses approved so we can get work done. And similar things are happening in other projects, and it's a lot of information that a lot of people really would like some access to. And for me to build a report is one thing, and I can do that even weekly, but it's not nearly as good as actually having some place where people can just log in and take a look at whatever it is that they're interested in. So they could see, the timeline for, the CRT or the training center or something else that we happen to be doing. Or they can look at, just the operations or the facilities. They can look at budget, or all these different charts, different ways in which to measure the data information that we're working with. And the only real way to do that is to put all that information into software that is cloud-based, so it's accessible to public people who are working on it. And there is some software that I really like. I did quite a bit of research. It's called Monday.com, if you're interested. And they have a lot of different ways that it can work for you, one of which is project management, which is, of course, works best for us. And it is just under $1,000 a year. It has to be renewed every year, and unfortunately, we cannot pay it monthly, which I wish we could. But it really would take all of the work out of making this transparent, making Measure B transparent. It would just be very simple. Anybody, we would have a public law on that would have something, but then ours as well. And you could just go in and look at the updates. So I would very much like to have it. We would use it for the entire duration of the project, and everything we get added to it along, so that we could run concurrent timelines. That's all I got. Hopefully
Okay. Committee comment.
Yeah, it's Mark. I think if there's any way that we can ease the flow of communication and increase transparency, I think $1,000 is a well-spent investment. I would be in support of that.
Mark, this is Almond. If that's a motion, I'll second it.
Is that a motion, Mark? Do you move that?
It is a motion. It is a motion.
Almond second.
Any other further committee comment?
I'll just make one. At our Behavioral Health Advisory Board meeting, I know this is Emily asked Allison for some information and wasn't available to give it to her, but did say that this platform would allow her to get the information out to our board members. So I think it's a good use of allocating funds, but it's important.
Thank you. Any further committee comment? Public comment? Seeing none. Allison, could you please call for the vote?
Yes, ma'am. Right. Member Barish?
Yes.
Member Almond?
Aye.
Member Diamond?
Yes.
Member Miller?
Yes.
Member Riley?
Yes.
Member Ferrata?
Yes.
Member Angelo?
Yes.
Member Weir?
Yes.
Member Myrtle?
Yes.
Member Liberty,
Yes.
and
Yes.
everyone's good.
Okay, thank you. 3H, discussion and possible action regarding expenditure report on Measure B tax funds. Lloyd.
Yes, good afternoon. I know it's getting late, so let me, this is a normal report that I bring you monthly. This is the latest through March. We have now received 22 months of our Measure B sales tax proceeds. We have a total revenue in the fund of $15,417,516. We now have total life-to-date expenditures of $531,135. We have a life-to-date interest earnings of $165,476. And so today the current Measure B fund balance is $15,051,857. And that's my report.
Thank you, Commissioner Ware. Any committee comment? Jed?
Yeah, and clearly there's going to be a drop in the short run, maybe the long run. And I assume you'll keep us posted, Lloyd, in terms of any expected drops or things we would need to look at as we're looking at spending money. We need to know how much we're likely going to have in the future.
Yeah, I will be monitoring that. As a county, we are also, very concerned about sales tax performance. So we are working with our outside consultants. So I will have some insight going forward. Just remember that sales tax is about a 2-month delay. So, it's going to take us a little time to get out to where we see what effect this has had. But I will be bringing that back to you once I know any outcomes.
Thank you.
Okay. Any further?
Somebody went on hold.
I'm back.
Party time.
Any comment, please? See none. Thank you, Lloyd.
You're welcome.
Item 3I. Oh, I was going to skip this one because it's me. Discussion and possible action regarding report from the Kemper Ad Hoc Committee.
Hey, Donna, can
Yes.
I jump in? You asked for public comment on 3F or 3H?
Yes, I got a public comment on them all, I believe.
Okay, can I say something real quick about 3H, Lori's report that he just finished?
Yes.
Okay, so I'm just wondering, and I've mentioned this more than once, whether or not someone is going to put together an overall budget for the Measure B monies and what kind of timeline we could expect for that to happen. So, because when I look at this expenditure report, I just can't imagine spending millions and millions of dollars without a plan for it. That's all. So I'm just I don't know if anyone can address that or would address it, but
we have it noted. Duly noted.
Okay.
Thank you, Sherry. Appreciate it.
Thank you.
May I?
A little delay on my item here. So we did meet on March 6th and we discussed items, and we'll continue to hone in on things as we enter our journey. What we did settle on is the prudent reserve. This item was brought before this committee in December. with a recommendation for a 15% prudent reserve. It was continued in January and February, and the ad hoc discussed it and again came up with 15% for prudent reserve. I would like to have discussion, entertain a motion, and see a vote come forth today, one way or the other, so that we can move forward on other items. So committee, I keep wanting to say community, I apologize. Committee comments, please. Jed.
Yeah, what I think, at least I think a prudent reserve is a good idea. I think most people did. I think one of the questions that I have is, if we approve a prudent reserve, is that money locked into it forever? Or if we, have an emergency, how can you take it back out again? That wasn't clear to me.
I am not going to assume, because I come from private industry, but I would think, and I would appreciate if either Member Weir or County Council would make sure if I am wrong, but it would be, to me, exactly what a prudent reserve in any county, city, state, and your own personal private prudent reserve would be. It's there for emergencies. It's there for at the end of 5 years, should we run short. If we happen to come in perfectly on balance, it could be there for maintenance and repairs at a later time. That's my private idea of a prudent reserve. And if I am wrong, Lloyd or County Council, please advise me.
Hey, Donna, this is Lloyd. You're not wrong. We can reserve any portion of the $15 million that we have. Normally, that's done once a year by your Board of Supervisors, who by 4/5 vote can create a designated reserve in any fund. So it would just be a matter of protocol at the end of the fiscal year to determine the amount that would be placed in a prudent reserve.
Thank you. Do I have any other further committee comment? Mark, are you?
Yeah, I'd like to speak. Thank you. So we're asking for 5.7 million to be placed in prudent reserve for monies that can't be spent. Is that what's being asked?
It's for a prudent reserve to be spent on emergencies should we run short monies at the end of the 5 years. We will have that to fall back on. And if we run perfectly, smoothly, and wonderfully, it could be used for maintenance and repairs later on for the buildings, et cetera. And the service monies, it could be used for operations, et cetera.
So that basically is money that we can't use in our, I guess, in our projections for budgets for CRT, CSU, PUF. So 38 million less the 6 million, less the 1 million, less the 500,000 that we've already spent. Is that an accurate summation of what's being, I guess, considered?
Considered, yes.
Can you say that again, those numbers for me?
38 million, which is the projection, 6 million, which is the reserve, 1 million, which we approved today, and the 500,000, which has been spent. Oh, I forgot the 3.3 million that we spent for, or are going to spend for the architect.
further public comment, or excuse me, not public comment, I apologize. Committee comment. Yes, Commissioner Allman. Unmute yourself.
I apologize. Remember,
Thank you.
it's the board that makes this, and to Mark's point, yeah, I agree with Mark what you're saying. However, our reserve would be listed on every financial account that Lloyd would give us. It would certainly tell us what our reserve was, and then a reserve is exactly that. It would go to where the money is needed. I think a prudent reserve is necessary, but it's not an untouchable amount. We'll be able to get it, through the board when we believe we need it. We're not spending it, we're saving it.
Thank you, Commissioner Allman. Any other further commissioner comment? Public comment?
Sherry?
Yes.
My question is, why do a 15% prudent reserve of the projected 38 million when, especially in these times, that number is probably going to change? And why not do 15% of the revenues that have actually been received instead of locking so much away of money that may or may not be received? So 15% of, I guess it's about 15 million plus that's been received so far. Why not do 15% of that?
I believe, and Lloyd, please tell me if I'm wrong, that it is only on monies as we receive them, correct? Lloyd? Did I lose you?
This is Ross.
Yes.
I would think the way it would actually roll would be you'd have it would be a prudent reserve percentage as you receive it, but then it would top out at some point. So say you do you go to collect the 38 million and then you have whatever $56 million in reserve. Well, most likely you're not going to keep, if you don't use that money, you could roll that over. You wouldn't keep putting aside a 15% ad infinitum. I wouldn't think. Although Carmel would know better than me. I don't actually do budgets.
Yeah. Commissioner Angelo, please.
So how we do our reserve within the county system is our policy is 6.85%. So like and 15% is a pretty hefty reserve. But Ross is right with what he's saying. So we have 15 million in there right now. So if every year we would try to stay at 15%. So it's not 6 million now. And if we have a year where we don't have a lot of, we basically would stay. Say if the committee wants to do 15%, it would be 15% of the 15 million now. And then every year it would probably go up just a little bit. So, and it's a 4/5 vote that if we needed to use that money out of reserve, we would be able to use it. I'm sorry, I hope I answered your question. I was on another call. Did I answer your question, Chair Muschetti?
It was not mine, it was Ross's, but yes, thank you. Any further, Mark, did you have something?
Yeah, I'd like to. I think that adding that big of a constraint when we don't know what the operations costs and we don't know what the building costs and we don't know a lot of the costs because we haven't created or have the information for budgets is just a further restrictor. I'm not against having reserves. I'm fiscally conservative. My business has reserves. That's exactly the way I think it should be. But putting that type of limitation on us at this point may not get us all the institutions and or services that we need. So, I'd like to see that, be 10%. I still see that as a lot of reserve. But that's me.
And thank you, Member Myrtle. This is just a recommendation, and whomever makes the motion to do whatever can throw out whatever percentage they wish. It was just a recommendation from us. Any further comment? Yes, I'm sorry. I'm not sure who was first, Shannon or Tom.
Shannon first.
Okay. Shannon?
Well, I agree with the need for a prudent reserve. I also agree with Member Myrtle that 15% seems kind of steep. In the interest of moving this along, I would like to make a motion that we create a reserve that is consistent with the county's policy. I'm trying to remember what Carmel said. It was 6.85%. Seemed like a very random number, but I'm sure there's some logic behind it. It seems like we would be wise to be consistent with the county's regular procedures. So that's my motion.
Do I have a second? And then Member Allman wanted to speak. But do I have a second?
I second.
Okay, and Member Allman, comment?
I'm good with that.
Any further comment from the committee?
Madam Chair, if I may just note, I think the motion was to create a reserve. I just note it's a recommendation to the board to create the reserve.
Oh, thank you. Thank you.
Yes, that please.
Any further public comment? Allison, are you still with us? Can you call for the vote?
Ma'am. Member Angelo.
Yes.
Member Muscotti.
Yes.
Member Riley.
Yes.
Member Almond.
Yes.
Member Ferrata.
Yes.
Member Diamond.
Yes.
Member Barish.
Yes.
Member Miller.
Yes.
Member Weir. Oh, he disappeared. Member Liberty.
Yes.
Okay.
Member Myrtle's yes.
I didn't see you in there.
Thank you.
I'm sorry.
Okay, thank you, everyone. 2 more items to go. They are informational items to my knowledge. Item 3J, discussion and update regarding approval of request from Mental Health Treatment Act Citizens Advisory Committee for Board of Supervisors to direct County Council to conduct legal evaluation, research analysis, and assessment of Adventist Health Partnership legality, including restriction, necessary control, implications, and compliance regarding the possible use of public tax dollars to fund operations of a private entity. Allison.
Actually, we have our county council, Christian Kurtz, here today to answer this. He actually wrote the responses, so I'll hand it over to him.
Thank you, Madam Chair. I'd just like to say, I believe you've all got the document with the responses that I had to all of the questions. I thought there were some very good questions. The bottom line on the Measure B part of it is that it looks to me like as long as the purpose is consistent, that spending something on a building or on services that would be provided by an outside entity is not prohibited by the purpose of the measure. I did go ahead and take a look at both the ordinance itself as well as the materials that were submitted to the voters as part of that. In terms of the overall restrictions, there's kind of a lot of possibilities in terms of how you might be able to restrict the use of property going forward. There's a number of different mechanisms that get used in this context. I tried to provide a bit of a summary of those, but I'm hoping that I've answered your questions, and I want to see if there are any other questions that members of the committee may have.
Committee members, any questions for County Council?
I don't have a question, but I've got some thoughts on it. That's okay.
Go ahead.
So I agree with his legal opinion. Of course, he's the attorney. But I think when you do a public-private partnership like this, and the private side is going to be owning the buildings and basically owning the result of the public expenditure, it gets really complicated. And I trust Adventist Health. I'm actually on a couple of their boards, but as with any of those kind of situations, if we ever enter into an agreement with them, try to contemplate, if you are on the other side and you wanted to game it and make money on the deal and be a capitalist or whatever you want to call it, I would say, look at how it could get gamed, because that is the nature of those things. And this isn't a comment about Adventist Health at all, because I trust them. But you've got to really watch those kind of public-private partnerships, because they're often gamed. That's all I had. Thanks.
Thank you, Ross. Any other questions?
Yes. Donna, this is a little confusing to me, because the plant itself, the building, is not privately owned. It's owned by the hospital district on the coast, and though Adventist Health will be managing it, they're not going to own it, and the changes made to the plant will not be on a private facility. It'll be managed by the partnership will be in management, but not ownership of the facility itself.
Thank you, Commissioner Barris. Yes, Commissioner.
My question is not about the analysis. Thank you for that, County Council. The reason we had asked for this analysis is because my understanding is we were to receive a detailed proposal from Adventist Health for their services, and I guess I expected to have that by now. Do we know what the status of that is?
Yes, Commissioner Angelo.
Chair Muschetti, we don't have a detailed proposal. And can I just take 30 seconds on this one? As you recall, it was my supervisor, Ted Williams, during a board meeting that brought this up, that he had talked with Jason Wells, and that the hospital was willing to do the psychiatric unit for us for next to nothing. So I went ahead and did meet with Jason, who was basically confirmed what Supervisor Williams had said, and said that, and we met, and actually Dr. Barish met, and he wanted to know what I wanted. And basically, Shannon, what you're saying, I wanted a written proposal that had, dollars in it, and basically said what they would do, what the cost would be, startup costs, all of that. And so based on everybody's schedule, then Jason came back, and Dr. Barish said that he would work with me, and that Jason did not have time. And that was about the time that they were assuming the Fort Bragg hospital. And so Dr. Barish and I met, and Dr. Barish had a letter that he submitted. So at this point in time, we do not have hard figures that would speak to what the cost would be if Adventist ran a 24-hour inpatient psychiatric facility for the county, whether it was on the coast or inland. So either we revisit it with Adventist, which we could do with our legal opinion, or we don't. But I would say that in order to get those figures, Shannon, that Adventist would have to assign one of their fiscal people to actually put that together. And I don't know, based on everything that they're doing right now, that they are still in the same position to do this. And I would just ask Chair Muschetti, if okay, if Member Barish has any comments to make on this.
Member Barish?
No, I have no comment right now. I can pursue the matter if you'd like, but like you say, there is a lot of flux at the moment. I don't think that the previous thinking has changed, but I will have something more to say at the next meeting.
Thank you. Any other committee?
Yes. Yeah, I would appreciate follow-up on the item. Otherwise, this is all kind of a moot point. I think there are definitely some economies of scale to be achieved through having operations done through Adventist Health. So understanding that things have changed, if we could do some outreach to them and figure out, otherwise we don't need to spin our wheels on this item. Thank you.
Thank you. Any further committee comment? Any public comment? Okay, thank you. And we are now on item 3J, correct? We're in agreement? Okay, so this is discussion and update regarding approval of requests from Mental Health Treatment Act Citizens Advisory Committee for Board of Supervisors to direct County Council to conduct legal evaluation, research analysis. Didn't we just do that? Did I miss something?
Yeah, we're on 3K.
That's it. Discussion and update regarding the CRT or Crisis Residential Facility. Allison.
All right. I'm hoping that Janine will join me on this as well. So we are getting through the CEQA process, which is all of the environmental. We're actually pretty close to getting to the point where they're writing the environmental document and moving into looking at the construction phase. We have the eventual construction team working together. Sally Riley, who is a consultant, as well as Doug Anderson and Dan Mazzetti. Anyways, both from the. Can you guys hear me? I can't even tell. Can you hear me?
No.
Donna?
I can now.
Okay.
Now I can hear you.
No.
Nelson, we can hear your words, but it sounds like you're from Mars. So
maybe Janine, will you take over? They can't hear me.
Yeah, that's
Give
right.
them an update, please.
Sure. I'll give Allison might have more information, but I'll give the update that I have right now.
All right. Well, at any rate, we are preparing. We are preparing to go from the environment.
What's happening? What's happening?
I think there's a delay or something going on. So we are. I think what Allison was trying to say, we're still continuing to work with Nocton Lewis. We did have our first meeting with Nocton Lewis and the city of Ukiah to start that conversation. They're continuing to progress on the design plan. So it's not the actual architectural plan, but it's sort of a design scope on what we would be looking at. And we are hopeful to have another design plan, conceptual plan, probably in the next week or two. I think, Allison, they were going to look at it. We are asking them for some simple changes. We will be going in front of CHAFA again with an update on April 30th, I believe it is, to give them an update of where we are, to make sure that we are meeting their timeframes along with our timeframes. At this time, we are still on track with our timeframe. We've been checking in on that regularly to make sure that we are still meeting the timeframes to be able to meet CHAFA's timeframes. So at this point, we are still on target for that. And I know Allison asked me to mention, we are in the process of writing a RFP for a crisis residential treatment operator.
Thank you. Any community comments? Any public comments? Emmy?
Yeah, I would like to speak.
Oh, sorry, Mark. Sorry, Emmy, I'm going to get back to you. Mark came in late on me. Go ahead, Member Myrtle.
So, Janine and Allison, did you mention that we have solicited or we're working on an RFP for the CRT? Is there any solicitations for a CSU or a PUF unit? I would thinking that would be prudent for us to see if we can get interest in that before we spend millions of dollars on the design of those facilities.
So in the current RFP that we are writing, I'm not addressing those two facilities at this time.
So in September we passed that to be done, and I'm not saying that that's the behavioral health responsibility to do that, but I just want to know what path we should do to move forward to move those RFP proposals forward. Allison, Carmel.
This is bleeding into the next item, so I don't know if Chair Muschetti, how do you want to do that? Do you want to?
Okay, correct. Yes, Mark. Thank you, Allison. Member Myrtle, it's pretty much addressed in 3L, so we'll come back to that.
Chair Muschetti, can I make a comment?
Yes.
Yeah, the negotiation with Adventist Health, I think, would take the place of a PUF RFP.
That's again on 3L.
Okay.
So any other committee comments? Public comments? Emmy, sorry that I interrupted you the first time. Oh.
You're on mute.
Microphone. There you go.
Got it. Emmy, good. And mine is actually a question. When you're talking about what you're doing, are you talking about the property down in Ukiah that's, that's involved with this grant and so on? Is that what we're talking about right now?
The CRT, yes, ma'am.
And so that's already a done deal then, that's where that's going to be. Is that also, because every time I've ever talked to anybody, they've always said, no, nothing's been finalized, nothing totally decided, but it sounds like it is.
For the CRT only. There's two other things.
That means they're going to take that property and they're going to build this 2 or 3 story building on that property. Is that correct?
No, Janine, would you like to answer that, please, really quick?
Sure. The facility that we're looking at building right now on Orchard Street is a crisis residential treatment facility. It is a 1-story building that will only be used at this point for crisis residential treatment. The plot of land is large enough to put potentially a second building, but at this point there is the design will not be 2 or 3 stories. It will be a 1-story crisis residential treatment facility.
Okay, thank you, Janine. Any further public comment?
If that's true, then that really means that you've already made a decision that won't take place at some place like Howard Hospital, correct?
No, not to my knowledge. And if I'm speaking out of turn, please somebody let me know.
No, you're correct. Chair Muschetti.
Any further public comment? Okay, thank you. We will move on to 3L, which is the update concerning December 10th, 2019 Board of Supervisors meeting regarding direction to perform an operational feasibility study of proposed Measure B funded facilities. Allison, can we hear you?
Can you? Am I good?
Yep.
Okay.
Right now.
Yes. So, Carmel and I discussed this actually before your shelter in place took place, about handing off the operational feasibility study to me. And I have been working on it. In addition to the RFP that behavioral health is planning on issuing in July for the CRT, I have received many different examples of exclusively plus units that have been built around the state of California in the past 2 years, or that are 16 beds or smaller. So the operational size that we've been discussing, and just working on the numbers. How much did it cost to build, per square feet? How when was it built? How many staff do they have? And I think through that, and also hopefully through the help through Falcon, which is a company on the East Coast that's been helping us with the mental health facilities that we've been building in Mendocino County so far, that we will have an answer, kind of an aggregate of what the operations and the actual build cost before we go and do any of it. Were you able to hear me okay?
Pretty much. Thank you, Allison. Any committee questions? Mark, did that answer your question?
I couldn't hear it very well. I'm sorry.
That's okay.
Yeah.
I can write to you later.
That would be good. I mean, it sounds like there's some negotiations that part of the committee know that others don't, and it just seems like, yeah, I'm just not sure what's happening, except that we approved that RFP process in September, and and things are happening that only some of us know. So that's all I have to say.
I'll send an update to the entire committee regarding that specific topic this week.
Thank you. Any other committee? I muted myself. Any other further committee comments?
Well, I just want to comment to what Mark said. I don't know of any other committee members that know what Allison knows. I'm not in the know of that one. I don't think there's any kind of conspiracy of some people know it and some people don't. But Knox and Lewis has been our biggest expenditure so far. And I think it's fair for the committee as well as for the public to get a genuine written explanation of what's going on and a timeline of when things are going to be happening. That's a lot of money we're spending.
I have a comment.
Yes, Ross.
I'm with Tom and Mark. I think what Mark's trying to say also is, the board said they wanted to get a sense on, what is the feasibility of being able to operate these things with the money that Measure B is going to bring in after their bill. And I'm still struggling with, we are spending a bunch of money to design facilities or determine the best place to put them and all that. And we don't know if we can actually operate them. I'm really worried about that. It seems like a cart before the horse kind of situation. And I haven't brought it up that much because I feel like, well, I must be missing something here. But that's what it increasingly looks like to me. Thank you.
Thank you, Ross. Further committee comment? Yes, Commissioner Angelo.
Thank you. I just want to say that in fairness to Allison, this item, the original direction, and I know it says this, but back in December, the direction was given by the Board of Supervisors to me in my office to perform the operational feasibility study. And this was, and somebody had mentioned the Adventist. So that's where we started. And, you know, and my hope is that Dr. Barish will go back and get Adventist to actually give us a very detailed financial proposal on that. But as far as the operational feasibility study, that was part of it, and that was a big part of it, because if Adventist came in with something that was really reasonable to operate a 24/7 inpatient psychiatric unit, then possibly we would not be talking about building anything. So that was a big piece, and that has not come through yet. But as far as the actual operational feasibility study outside of Adventist, the board asked about Kemper, and we did go to Kemper, and he does not have the time to work with us on this. I don't think we heard Allison because of the sound, but within Naughton Lewis has a subcontractor that does just this, which is operations around inpatient psychiatric facilities. And we have talked with that subcontractor about working with us. To my knowledge, they have not come back with any type of solicited proposal about what they could do. So this item now has gone from me, because I'm not able to do this, I do not have the time to give to this, to Allison. So she has just assumed it. And so that's where we are with this. If there's any other additional information, I don't know what it is, but that's where we are. And I also agree that, you know, there was a time back in December where, yeah, well, it would be great to do an operational feasibility study. But now going forward in April, going into May, when we know we have 1 quarter of very limited tax dollars, and then going forward, we're not going to be at 100% of tax revenue, you know, at least for another year. So right now is really a good time to look at how much money we think we'll have and what it will actually cost. So I fully support what Ross is saying, what Mark is saying, and what Tom is saying. So it's just a matter of moving forward. And this will be something that it will be a big work effort on the part of Allison to get this done. So anyway, thank you.
Thank you. Any other further committee comments?
Just one from me. I promised my last one for a while.
No worries.
So what I'm hearing, Carmel, I mean, I feel like I'm better on the same page now. But I mean, should we really keep Naughton Lewis, whatever it is, flat out, going down the path of determining, where to put a building and what the building looks like and the architectural, when we really don't have that feasibility study? I mean, that just seems goofy, right, to do that. Should we put the brakes on them until we know? So that's just my question.
Allison, did you have something to say real quick? If we can.
I do, yes. Ross, there's no way we're going to start another building before we actually get a budget for the design.
Allison, we can't hear you.
How much it's going to cost to build, let alone operate. Won't happen.
We can't hear you. Member Angelo, did you have something to add?
Oh, sorry.
The only
Allison, if you turn off your video, you'll have bandwidth that we can hear you. Try that.
Okay, and on that, Commissioner Angelo, do you have something to say? I'm sorry.
I don't have anything that anybody would want to hear. I think that we are, there's no way we're going to get $38 million. And so I think that this committee really knows, I mean, the unspoken, what we're not saying is, that we're not going to bring in 38 million. And so what should we do? And I don't think that the thing that Allison may have been saying, I don't know, is that I think the only thing Naughton Lewis is working on right now is the CRT. And maybe you can shake your head. I don't think they're working on doing anything but the CRT right now. So this is the time to really look at, can we afford a PUF? And, what can we afford? And I thought we took the crisis stabilization unit off the table. I thought that was gone. And we were talking about residential and a 24-hour inpatient. And so if all we're working on right now is the CRT, because that's the chunk of change we have and what we've been working on, and it's the 24-hour psychiatric inpatient, then that would be the operational feasibility study that we would need to do. But if the Adventists came back with something very reasonable, it may be that that is the move that this committee would recommend to the board.
You froze out. Any other further committee comment? Yes, Jed.
Yeah, I think what I'm hearing that we're kind of getting to is that we're in uncharted territory in terms of how much money is going to come in. And it seems to me prudent, whoever said it, I'm not sure now, that we hold off any of the other expenditures that Naughton Lewis are doing or planning until we get two things. One, a better idea of how much money we're actually going to have. And secondly, whether Adventist Health proposal is anything reasonable that we would want to do that would preclude some of the other things that Naughton Lewis might be doing for a residential program. I think we need to know that before we get too far down the line and spending any more money. I think that's the sense I'm hearing.
Okay, thank you. And if there is no further community, God, I will quit that by next month, I promise. Any other committee comment? I'll do a quick public comment and we will wrap up with our final statements. Yes, Supervisor Haschak.
Yeah, I just wanted to add that I wrote a letter to Allison Bailey about requesting timelines and what was actually going on. And I think what the committee's done today is recommending this purchase of the software will really help everyone be more informed about what's going on, because I think that there is this information gap probably happening with everyone, and hopefully we'll all be on the same page with this new program, because we all want to know what the timeline is, what's happening with the budget, and those critical issues so that we can make informed decisions. Thank you.
Thank you, Supervisor. Any other comments? Public comment? And since we cannot, Allison can't talk, or she can talk, but we can't hear, I will go around the room and ask for your committee member reports. So Commissioner Allman, anything?
Nothing, thank you.
Thank you. Commissioner Ferretta?
Nothing at this time, thank you.
Commissioner Barish?
Nothing.
Commissioner Angelo?
No, thank you. Thank you, everyone.
Commissioner Diamond?
Yeah, nothing new from me. I just appreciate everybody. These are difficult conditions we're operating under, and our time is stretching, but I appreciate everybody for hanging in there with us all.
Commissioner Miller?
Nothing.
Commissioner Myrtle?
Nothing.
Commissioner Liberty?
I just have, I second Jed's comments, and also I want to say I appreciate the tie-dye shirt that he's wearing. And I also have a question for County Council, for Christian. This Zoom app has a Zoom group chat, and I need to make sure that that's public, because if I'm corresponding on that during a Brown Act meeting, I don't know if, and it's going to everybody, then that needs to be something that's visible to the public. And I don't know if it is. That's all.
Well, I will say technologically, I don't know the answer to that. You're correct that anything that's going out to everyone should be public, but I don't know how it's configured or how it's set up.
Okay, so yeah, so maybe a little bit of discovery on that part, and if it's not discoverable by the public, then we probably need to disable that feature because it's too tempting for me.
Thank you. Member Weir and Member Riley have exited the meeting. I apologize for this going so long. A little bit of it was technical. We will hopefully get everything straightened around. I want to thank everybody for being here. I want us to look at prioritizing things and come up with, prepare for some alternatives should we need them. And there's a lot of information out there on evidence-based practices, facilities, etc. So I hope to see you all in a month, and then I hope to see you in the same room. Thank you very much. Meeting adjourned. Sorry.
Thanks.
Bye. Take care.